Hello, how are you today? Good morning. Uh, Medical class. So happy to join you today in our course, mainly listening skills, and we have grammar, the most important features we want to discuss today. We have conversations, and we have different topics in listening activities. But before this, I'm so happy and delighted to send my regard to Honorable Dr. Shane, Mrs. Jessica, and Dr. Justins for those who have been engaged and active, provided nice lessons, spending much of their times, great efforts to deliver this task. I'm going to say for them, thank you so much. I do appreciate your contributions around the world and enhance process of teaching in different globe in different world. So I'm so happy. Here I am from Sudan. I'm going to send my regard to you. You have been exert a great efforts to enhance the process of education since from the early courses language like cake. Okay, so quite I do appreciate. I get more advanced and benefits from these courses actually to enhance the process of teaching. Here we are in Sudan. Actually, we are working online because of ongoing circumstances that is push us to work through this. When I get this opportunity to develop myself in these courses, so in my class today, I have been working online. I'm going to show you in these lessons to present activities related to listening skills and presentation skills and summary skills and grammar skills. So my class is about medical students. So medical students had first year at different colleges. Specifically, we have students in Al Fajr College. Just we are going to record this lecture for them because the students they found the content through my channel in Telegram. So my topic today, listening activities. Before we go to the topic itself, let us me discuss the main objectives of the topics. All of you previously we had listening activities mainly about conversations between patients and nurse. We develop our abilities in communications between patients and nurse so as to mitigate the severe the challenges the problems of patients who actually suffering. We have to use a nice conversation with them so as to develop approachable manners, that is to say the patient nurse dealing with patient in a perfect way, and also we develop abilities in spoken language is how we can develop students their abilities by having activities of listening a lot, and then we have a role play. First of all, students they listen to record again and again twice, for example, intensively, so as to understand what the conversations about. For example, is it doctors and teachers, or teachers and doctors, or patient to doctors, or appointment, or the process of having appointment, examining the disease, whatever. So in this case, students are able to analyze, to evaluate, to discuss the conversation, and then they have listening to similar conversations, so as to identify, for example, understanding where and when these situations between whom, analyze the grammar, for examples. This is the most important features students should have moved through. We develop students their abilities by having summary and by having presentations. Through these presentations, students develop themselves in ability how to communicate well in perfect way. Today, before we started our lessons, just we are going to have analyze the grammar, what sort of grammar we want to use them. We have two things we want to focus them. The main objective of them, we have to use simple past and we have to use present perfect. Why we use simple past? So as to enable us to have a record in the past about the situation of the patients, how we can monitor, we how can observe, and we use present perfect so as to compare ongoing situations. That is to say, current situation of the patients himself or herself. So by understanding these rules and grammar and functions, enables them to able to write at least a report at least a case about the patient history, and then comparing between the present and the past using certain languages, especially the past. Mainly, we said that we use past to focus on events that has happened in the past. We use them so as to help us to describe an idea that is completely in the past. We use the present to describe current situations so as to having the foresight for the future, how we can deal with any kind of challenges or problems related to patients. So here, the main objective we want to achieve them, students at the end of the courses able to communicate well